Good morning, everyone, and welcome to this session where we really have a great treat having a conversation with Sumbul Desai of Apple Health. I'm Alice Park, Senior Health Correspondent at Time, and I'm really excited and looking forward to this conversation because I think Apple's had a really great year this past year, a lot of new products, interesting indications, and maybe we'll start there. Just tell us what has happened in the past year, because some people may not be completely up to speed on the new products.
Absolutely, and thank you for having me, and it's always a pleasure to chat with Alice, so I'm very excited about this as well. Over the past year, we have released a few products. So on Watch, we introduced sleep app notifications. We now, if you wear your watch overnight, we can look at breathing disturbances and notify you if we have a pattern of moderate to severe sleep apnea. And that was cleared through the FDA as well as other global regulatory bodies, so it's available in a number of countries worldwide. And then we also introduced, one of the things that I was probably most proud of this year is we introduced the hearing aid feature on AirPods Pro 2. So we have a hearing test and a hearing aid along with this loud sound protection capability, and this is really an end-to-end hearing experience. So one, everyone can use loud sound protection. So if you go to concerts, you put your AirPods Pro 2 in, it actually will lower the decibel level of the sound, but you still don't lose the richness of the media that you're experiencing. And then based on the Apple hearing study, we introduced our hearing test. And what I love about what we did is you take the hearing test at home. So we're democratizing a test and bringing it to you at home. And then we actually give you an intervention. Should you have moderate to severe hearing, mild to moderate hearing loss, not severe, mild to moderate hearing loss, you can actually just with the tap of a button turn on the AirPods Pro 2 hearing aid feature, and it will augment the frequencies where you need some help. And just what we've heard from customers already, it's been quite life-changing. We received some letters that actually always blow me away, but these ones really blew me away in terms of the impact it's had in terms of bringing back social connection for families. And those have been the ones that really stayed with me, and so we're so proud of that product and something we've worked on for a number of years.
Okay, so your CEO, Tim Cook, has said that he feels the biggest impact Apple as a company will make. You know, we're all familiar with the phones, the AirPods, you know, the amazing things that the smartphones can do, but he thinks the biggest impact the company will have is in health. So I want to just take a quick poll. How many folks out here use their phone, wearable, anything for monitoring any health feature? It doesn't have to be an Apple product. Wow.
It should be an Apple product.
Yeah. All right. So, so tell us a little bit about what that means at the company. You know, when Tim says that health is really a priority for the company, what does that mean, and what is the vision for that? Like, how does he hope to impact people's health with their devices?
I mean, I think it really starts with, and I think what we have always stayed true from, like the origins of when Steve was there, is the human impact and the human connection that technology has, right? We don't want to lose the impact that individuals feel from, like, how can technology augment their lives in a very meaningful way? And what it means is, from a company level, we really do think about health we think about health across all of our platforms and products. So not just Watch, we think about it across everything. And we think about it, when we start thinking about our product development process, we really think about what's the impact this will have on an individual and how many individuals can we impact. And we don't believe in technology for technology's sake. There's a lot of things you can measure and monitor, but it may not actually be impactful. And so we really start there. And so from the product development process, we really think about, you know, will this have a meaningful impact from a health perspective? Can we do it accurately? Can our technology be differentiated in how we bring it? And can it be a delightful experience? Because especially with health, some of the things we're telling you may be, you know, anxiety-provoking, concerning. So we really think a lot about the human side of these experiences.
Sometimes there's too much information.
Exactly. And so we are really thoughtful about that. We will not give you data for data's sake. We want to give you data so it's actionable. And that's really some of our core principles. So, you know, if we think about what it means, is like our core principles are being focused on actionability, being science-based, making sure that everything we provide you is grounded in science. And then obviously we focus a lot on privacy from a human standpoint too. We really believe that your technology, you should expect the same level of privacy of your technology that you expect from your physicians and your care providers. And that's how we approach it. So to answer your question, I think he's really thinking about like the human impact. He gets letters literally every day. We see letters almost every day from customers on how our products have impacted their health and their life. And those really drive us to kind of continue to pull the thread to do even more.
So for your product development team, when you're looking at your Apple products, the phone, the watch, AirPods, can you just walk me through sort of the features of each, that then scream health, like, or a certain health application, like which products are ideal or potentially ideal if we're talking about down the road for what types of health metrics?
I mean, the reality is there's a lot that we've done on Watch, right? And Watch is the most personal product because you wear it every day. It has the sensing capabilities to pick up biometrics at the wrist. And so we've done things.
And those even include things that are not just movement, right?
Exactly.
Okay.
It's so beyond movement, we do, irregular heart rhythm notifications, we do ECG, we do AFib burden, we do VO2 max and cardio fitness, we do walking steadiness, fall detection, sleep apnea notifications, noise, loud noise detection. So we do a number of things. Cycle deviations, cycle prediction, we do temperature. So there's a number of things that obviously we can get from Watch. AirPods, we obviously have just started with hearing, but we will continue to pull the thread there. Phone, we have a number of experiences on phone through the health app. So we have, for example, a lot of our cycle experiences can also be done on phone. We have mental health, state of mind, so mental health reflection, being able to reflect on your mental health. We have medications, and then we have all of the trends and highlights that we pull together for your data on your phone. The way we look at it really is across our ecosystem, we really believe, we almost think of it as it's an honor of the fact that users keep these devices with them all the time. So we have a responsibility to be able to proactively provide information that will enable that person to think about their life in a healthier way and make them healthier. And so we pull the thread across all of our products to think about where can we provide information that's actionable, that will drive people to be proactive and preventative around their health. And that's kind of how we approach it across our product development process, across all of our products.
So we're now living in a time when there's really a lot more power being given to patients, right? Mm-hmm. They have access to their health records, access to more data about themselves. You're a physician, and you touched upon some of the pros and cons of that, like, sometimes having too much information or not knowing what it means or what to do with it. When you look ahead, as people gain more and more power over their own health information, as a physician, do you see that as a positive overall, a negative overall? Is that a good thing?
I do think it's a good thing. I will tell you from my own personal experience, and that drove me to do kind of what I do today. I had a family member, my mother had a massive hemorrhagic stroke in 2001. The best advice I got from the neurosurgeon that was caring for her was like, it is so important for you to advocate for your mom because she can't advocate for herself. But ideally, patients need to advocate for themselves to make sure they get the care they need. And the reason that stayed with me is our goal is to empower you with health information so that you can have the right conversations with your physicians. It helps the physician out, it augments your relationship with the physician, and you're empowered in a way to make sure that you're highlighting things that you know about your health. And from a physician standpoint, I think we do appreciate, especially this current generation of physicians, I think really do appreciate when it's a two-way conversation because they're more likely to also be engaged to do the follow-through, hopefully for treatment plans and making sure you're staying engaged with taking care of yourself. And so from my perspective, and if you think about with all of our products, this is probably lesser known for folks, but we provide a physician report for every one of our products. And the reason I've been so particular about us doing that is we want to not replace the physician. We want to augment your relationship with the physician. And so the physician report is a glanceable report that as a physician I can look at and not have to sift through a ton of data, but quickly understand what the patient's trying to explain to me. And I do that because I think that empowerment that the patient brings not just empowers them, but empowers the physician to be better at what they do and hopefully can lead to better outcomes.
What kind of feedback are you getting? You talked about feedback from consumers. What kind of feedback are you getting from physicians about that type of information, or patients coming in saying, you know, my Apple Watch told me this, or, you know, should I be worried about this? Or what is the doctor community saying?
I mean, overall, I mean, listen, I'm a physician, so we're a cynical bunch. So as well, we should be. And that's the right thing to do, right? Like you want to be thoughtful about the science and make sure it's, but what I think some of my favorite letters are the ones I get from physicians, where we get letters to say, and it blows my mind actually, they'll be like, we recommend Apple Watch for people to be monitoring their health, you know, their heart. I've had a number of cardiologists actually recommend Apple Watch for AFib. Monitoring.
That's like irregular heart
rhythm, and then AFib burden, which actually will tell you how often you're in AFib. And what we hear from physicians more and more, and I will tell you whenever I go out and talk to the physician community, which we do pretty regularly, they have so many more ideas that I wish we could do all of them. But in general, they're very positive about it. And the one thing that I want to make sure we call out is we designed our products to avoid unnecessary healthcare burden. Like we really tune our algorithms very specifically to avoid false positives. Sometimes at the sacrifice of sensitivity. But the reason we do that is we are very thoughtful about the physician community and how it impacts them downstream. That's the reason we did the Apple Heart Study. And the feedback we've received from physicians has been really great because of that. I think they understand our thinking in terms of how we drive our products, product development. And so far, I mean, there's always physicians that are still skeptical of technology, and that's okay. They should be that way. I think that's good. That's how they practice. That's who they are. But we have a number of physicians who are actually really excited about our products and are really complimentary in terms of how it helps them.
I'm curious about some of the other applications that they would like to see that they're asking Apple to pursue.
Yeah. Oh my God, there's so many. Like, you know, and some of them are just not possible. I mean, but some of them, I mean, I've gotten a number of folks who have said, hey, could you monitor more during pregnancy? And can we do more pregnancy monitoring? I think that's one that comes up. There's quite a bit in the cardiac space. They would love us to be able to do you know, like coronary artery disease detection and a number of things in that space. Some of them are not possible by some of the technology, and there's limitations to the technology.
And what the symptom, right? Like being able to detect the symptoms.
Because there's always like, you want to make sure in those scenarios, particularly in scenarios like that, it's not just correlation, like you have direct causation. And so those are important. I mean, this is not going to surprise everyone. I can't tell you how many physicians are like, can you guys build an EMR? But because
I was going to ask you that.
So that comes up all the time. But so it endless. I mean, you'd be surprised. I get things like, could you do CPR coaching and modify? You know, there's a number. I get stuff in my inbox almost every day on ideas. Yeah.
And, you know, we're living in the age of AI now. So, and clearly I'm curious about whether you also get a lot of inquiries about because we're seeing a lot of really effective applications for kind of virtual coaches in mental health, in addiction, other areas. Is that something that Apple is also looking at? Because it seems like you've got access to a lot of different types of databases, and all you need now is to sort of coalesce it together into some kind of a virtual coach or guide that can provide alerts, or, you know, maybe you should see your physician now, or, you know, this seems a little troubling. Is anything going on? Just something along those lines.
Well, you know, we never talk about future product, but
I tried, people. I tried.
But I will just say, I mean, I think we're really excited about the potential of AI. I think there's a ton of potential. I think we will. I mean, going back to that science-based theme, we are not always first to market for two reasons. One, we really truly believe the science needs to pan out. And accuracy matters a lot to us. We actually feel this responsibility of, given the fact that we're democratizing access to certain types of tests, we actually hold ourselves to a higher bar almost than traditional tests that are done with physicians, because we are directly giving something to a consumer. So that piece is really important to us. I think the other piece from a privacy standpoint, we go to great lengths. We don't have, people always say to me, oh my God, Apple must have so much data, you can do so much. The fact of the matter is we have zero data. That your data is on your phone. We do not have access to it. And that is how we have designed our approach and architecture. And as a result, sometimes we go to great lengths. When we do studies, we take a little bit of longer paths to make sure that we're doing it correctly and transparently with users. And so the reason I bring those 2 points up is when you think about AI, we want to make sure as a company, we are accurate. When we are telling you something, it's accurate, because obviously there's a risk of hallucinations, and we're really thoughtful about that. And we want to do it in a privacy-preserving way. And I think both of those things in the current AI space are legitimate challenges in terms of how do you take personal data and actually give you something back that is going to be accurate and actually do it in a privacy-preserving way. So the point being is we're very excited about the technology. I think there's a ton of potential for it, but we want to make sure that we do it right.
When you look at AI applications now in health, and we're seeing a lot, all the way from medical education, medical students are using it, to readings, like in radiology. So we're now kind of struggling with this idea of is a read from an AI bot enough? And in the UK, we see sort of them moving toward having like the initial read being done by an AI bot and then being reviewed by a human trained radiologist. When you look at those applications, how are you taking some of those learnings and applying them to your product development when you're looking at, other applications that Apple might have with the watch or the phone?
We pay a lot of attention to the accuracy of those things. It's interesting because my brother's a radiologist, and they're very excited about using it in the clinical setting in terms of helping with triage. There's so many scans at this point that the volume that they can now cover will increase, right? And that's pretty impactful. I think we take a few learnings from it. We look a lot at the accuracy. That's incredibly important. I also think we put a lot, going back to my earlier point, and we were talking about this earlier, we want to take the learnings that we think we can apply that will provide the user with benefit, but do it in a very human way. Because there is nuance in interaction that sometimes will give you more insights in terms of what's going on. So we really want to nail kind of that line between being accurate but not losing like the impact of the nuance. And so I pay a lot of attention to that when I look at other applications and how that's being done. And then we'll also obviously look at the applications that are better suited for us. Like not everything will be best suited for us, and we pay a lot of attention to that. We are very focused on the consumer. And we want to make sure that the applications we do are really more consumer targeted. And so what does that mean, and how does that play out, and what the impact is? So I take threads of the studies that we're starting to see, and we talk a lot with the medical community in terms of areas that they're excited about, and see what we can apply appropriately for our experiences.
And how much is it a part of your R&D, using machine learning and AI at this point?
We use a ton of machine learning and AI. I mean, most of our algorithms already have been done with like a ton of machine learning. For example, the sleep apnea study that we did to release our sleep apnea notifications was the largest machine learning data set on being able to detect sleep apnea. The way we did it is we actually ran studies where we had people take polysomnography and wear a watch. And then all of that study was quite large. And we took all of those data points and used it in our machine learning algorithm to develop our sleep apnea notification. That data set's actually one of the largest data sets that has ever been used to be able to develop a notification like that. So machine learning and AI has played a big role in all of our algorithm development to date. And so we're just going to continue to build on that and leverage generative technology over time. But definitely a big part of how we already do our work.
And you mentioned the sleep apnea study, but Apple also has several large studies in women's health, heart, and hearing. Can you tell us a little bit more about that? That may be something that most people aren't as aware of, that you have these data sets that you enroll patients and gather data.
Yeah, we really kicked off our studies work actually with the Apple Heart study that was done with Stanford in 2018. And we published in the New England Journal. And that was actually, we had 400,000 participants in a virtual study where we had individuals wear the watch. And if they received a notification, we kind of sent them a patch and followed them through kind of their care journey. And that was the first study that we had done as a virtual study. So based upon that, we then, a few years later, we've been running these studies now for 5 years, actually, introduced the Apple Research app, which brings together 3 studies. So as you mentioned, we have the Apple Hearing study that we do with the WHO and University of Michigan. And in that study, we have participants who are enrolled, where actually the Apple Hearing test that we announced recently was built off of the learnings that we received from that study. So we actually test things out within those studies and then kind of use that data to develop our products. We have the Apple Heart and Move study that's done with Brigham and Women's and the American Heart Association. That study is really focused on how do we take biometrics like your heart biometrics and correlate it with things like movement, but also other aspects of human health. So we use these studies really for 2 perspectives. One, to generate learning. So for example, from the Apple Heart and Move study, we also ask questions about sleep. So it turns out that only 31% of the participants in the study actually get the recommended amount of sleep. But we also use it to help us generate product development ideas. And so we, for example, the walking steadiness feature was designed off of the Apple Heart and Move study. And so we had about 100,000 data points and 100,000 participants' data that was used to develop our walking steadiness feature. And then the third study we have is the Apple Women's Health study, and that's with Harvard School of Public Health and the NIH. And that one is really, if you think about women's health, the data set that drives a lot of recommendations in women's health was done over 40, 50 years ago. And so this was an opportunity to work with Harvard to refresh that data set, but also add biometrics from watch. So we can look at how heart rate ties to your cycle, or if we see cycle deviations. So for example, about 16% of the participants in the Apple Women's Health study had cycle deviations where they had irregular bleeding, and that actually led to the development of our cycle deviation feature. And so we run these studies, one, because we transparently will enroll patients into the study. We tell them the data we're going to collect. They can differentially decide which data they want to share with the study. And then based upon that, we work with PIs who look at the overall kind of research, and then we get anonymized data to be able to do product development in areas that we're interested in.
So for the women's health, for example, as you mentioned, our last kind of big effort was several decades ago. And now we're hearing so much about midlife in particular, menopause and cycles, as you said. Are there applications that you're considering in looking at moving beyond kind of cycle deviation and that type of information to sort of help women better understand what's going on with their bodies?
Good try again on future products.
I'll keep trying.
We're very trained to figure that out.
But just in general, if we're looking at like where
Absolutely.
we can help women.
Yeah,
right?
and that's why the studies are so key. It's like we actually use them to kind of have the science lead the way in terms of our product development. And so obviously, when the women's health study, I talked about cycle deviations, but we're looking at women's health as a whole. And cycles are related to when you're actually actively cycling. It's also important during pregnancy. We've done some pregnancy features based upon that. And we obviously really pay attention to the transition periods too. Something we're very interested in. And so we'll continue to kind of pull the thread and see where the science leads us to be able to do more.
Okay, watch this space, right? And you talked about the sleep as well, because that seems like something where that is the type of data that previously people would have to spend a few nights in a sleep lab. Maybe they're not close to one. Maybe, it's artificial. It's not your bed. It's like maybe you sleep differently, et cetera, et cetera. And so how valuable is that data? Is this something like, particularly with sleep, it's such a big issue now. Are doctors kind of asking for that? Or if patients come to them and say, here's what my sleep is telling me, can you help me figure out like what I need to do? Or if there's anything I need to be concerned about here, that seems like something that doctors could really take action on now.
Yeah, and that's definitely one that we hear from a lot of physicians. They would love for us to do more. To your point, like PSGs are very much, you question how good the data is because it's actually not how someone would traditionally sleep.
Right.
And so we get a ton of feedback from sleep physicians in particular, like, is there more we can do here? And we do find that the sleep data, it's interesting, sleep is actually one of the most used features that we have in our product cycle. Like I think people really, the sleep data really resonates with them. And we hear from customers all the time wanting more and more in that space. And so we are definitely interested in the whole sleep experience, not just like what happens at night, but like what happens during the day that impacts the night. So for example, we just introduced the vitals feature, and the vitals feature is collected overnight. And what we do is we allow for you to compare you against you. And so we look at your hours that you slept, your respiratory rate, your heart rate, your temperature. And that feature in the morning when you wake up will show you if you have deviations in your sleep or your blood oxygen level or your respiratory rate level. And what's cool about that is the data is collected during the sleep, but it allows you to inform how you're going to plan your day. It ties to our training load feature in fitness. So for example, if you're training really hard, we know that one, sleep helps you recover, but it also can impact your sleep. And so we're really looking at like what's the full kind of universe around sleep that ties to not just how you're sleeping, but how does it impact you during the day, and how does it impact your performance, and vice versa.
I would imagine that would be very helpful for like jet lag too, travelers.
It is, yeah.
Who are, in different time zones a lot to kind of figure out the best way to kind of make up for it or adjust once you've arrived, right, at a new location.
Very, like for example, I've been traveling a ton recently, and I was in Japan, then I was in Spain, and it was interesting in my vitals information. There's two things. Obviously, your sleep data changes, so it gives you a prompt of like, okay, you need to focus on the sleep the night. But also what's interesting is your resting heart rate will change when you're, not as hydrated based upon all the flights. And so that's actually something that's been kind of fun for me to look at. As I drink more water, I notice my resting heart rate go down. And so it's actually kind of a good prompt in terms of using it for other things around when you're traveling as well.
Right.
Yeah.
And you also mentioned the gait as well, because that I've been hearing more and more about has indications, or that could be a symptom of a multiple array of different conditions. So give us a little insight into how doctors would use that, like what that could indicate if there are changes in that or unsteadiness.
The reason we did the walking steadiness feature, it was interesting because a lot of people thought we were doing it for like an older population. The reality is your balance starts changing in your 30s, like if you're not careful. So, like there's all this focus in performance training around mobility and balance. And for those of you that, engage in athletics, you can notice when you have mobility imbalances, when you have balance imperfections, or you'll notice changes to your mobility, and it actually impacts how you run, how you walk. And so the reason we did that feature is when we noticed gait changes, we actually noticed it across a range of ages. It wasn't just seniors.
There's that, I think it's a TikTok, right? The grandfather challenge?
Yeah, right, exactly.
How many people have seen that? Where they take the grandchild, the parent, and the grandparent, right? And they're each told to take off or put on a shoe and tie a sock and a shoe on one leg. Without touching the ground.
And it's like all ages have challenges with it. And so one of the cool things about the walking steadiness feature is we will notify you if we notice your gait is slightly off. We do kind of ranges, but we also give you a number of, what I loved about this feature is it was actually the first product where we gave you an intervention. So we will give you a series of exercises that you can do to improve balance. So we used one of our Fitness Plus instructors to do a video to walk you through some of the things that you can do to improve balance. And so we were really trying to raise awareness around balance in younger people too, because it does impact. I get a ton of injuries because I actually have imbalances in my strength on both legs. And so that had created a number of injuries for me because I'm a runner. And I think people don't always appreciate that it can impact you across all ages. And it's something to pay attention to sooner because we know it can impact falls later on in life, and that obviously can have, adverse outcomes later on as well.
Right. You talked about the research app that Apple has. Are you looking to expand that, as you're looking to increase your presence in health and finding more applications in health? Where can we expect to see Apple kind of expand into research, and where can people join studies?
Well, we just recently actually brought those 3 studies together because originally we had them as individual kind of studies, and we don't intermingle data. And so we actually just relaunched the study and brought all 3 studies together So individuals now, when they consent to participate, their data can be used across all areas of health. And so that's one big expansion is like we want to look at overall like what the interconnections are between cycles and your balance or cycles and your cognition. And so we're trying to bring it together in one area. We do a lot in the research space, even beyond the Apple Research app. For example, we have an investigated-initiated research program where we give watches to researchers who go through an application grant process. We know we can't innovate in everything in health. We want to support the medical community innovating, so we do that quite a bit. And we also, for certain studies, will participate in studies with researchers who have interesting ideas. For example, there's an AFib burden study being run out of Northwestern that we've helped support through watches. So we really love to work with researchers in ways that we think can support the ecosystem of development in this space. And as well as, we run research studies for the reasons that I mentioned as well.
Can you give us a sense of like how many of those ideas come from Apple in terms of like, because we know our product very well and we think this is a good application, like this could be where it's useful, versus coming from independent investigators?
That's a really good question. In terms of product, I would say it's usually like 75-25. I mean, we know our product. We know kind of we know what our product can do and we know what our product can't do. And but it's usually a collaboration. So a lot of times we work with PIs and we'll have a back and forth. We've had some PIs suggest ideas to us that have worked with us. And so like it's candidly the way we develop product at Apple is it's so cross-functional, and that includes our PIs that we work with. So we have, engineering, design, our team, and we all sit together and kind of go back and forth. And we actually also, for certain products, will have external medical experts participate. And so candidly, I think it's hard to come up with that line because there's so much back and forth in terms of product development. But I think we obviously know a lot of the limitations. So we might have an idea that comes from someone, but then we have to refine that idea a little bit based upon what we can do and the limitations and also the accuracy standards that we want to hit.
Are there kind of ideas or areas that Tim comes to you with saying, I'd really love to see Apple be here?
Yes.
In this space.
There are. And we do them. We do them most of the time. I mean, if they're not a good idea, we sometimes don't always do them. But there are times when we just say, maybe it's this, maybe not this, but how about this? We get feedback. The one thing about Apple that's awesome is we get ideas from across the company. So at the most senior levels, but at the most junior levels too. Ideas come from everywhere. Like the cycle tracking feature was actually the genesis of like some folks on the team across a number of areas got together, like a number of junior folks on the team got together and came up with the idea and pitched it. And that's how we actually went through that. So that's one of the things I'm most proud of is like really like ideas come from everywhere. And the other thing is we can't do every idea. So a lot of times, we say, I often use this when I'm responding to concepts is that it may be a no now, but it's not a no forever, because we also do have to, one of the things that we really focus on at Apple in terms of our product development is focus and simplification. So that means that we have to say no to some great ideas, but we definitely keep them kind of on the back burner for future opportunities as well.
Talk to us about what Apple is looking at in mental health, in the area of mental health. Is that a space where we don't really see Apple at this point, but if you're blue skying and thinking, where could we be?
We do. So we do have a few things already in mental health. So one, in terms of the features we have out, we have the mindfulness app. We started with that. Obviously, we started with Breathe, and then we introduced the meditations through the mindfulness app. And then about 2 years ago, we introduced the state of mind feature, which is basically a user input experience on phone where you basically will reflect on an emotion you had and name it. And that's actually grounded in science, because if you name the emotion you're feeling, that's actually been shown over time to improve your resilience, and being able to identify your emotions will improve resilience over time. So you will name that emotion, and then at a regular period will actually surface up a GAD which is for generalized anxiety, and a PHQ-9 to be able to answer questions about depression. So we also will surface those questionnaires to the user. The reason we do that is we want people to get very comfortable with those questions because they may hear that from their doctor. And it gives them a sense of normalcy, one, to be able to answer those questions on a regular basis, but also longitudinally, emotions are something everybody has ups and downs. So we wanted to make sure that we make it clear to people that those ups and downs are normal, but being able to like identify and track it over time is really valuable. So that product we announced about 2 years ago. We also engaged, we're also involved in a study with UCLA looking at how biometrics may tie to certain emotions. And so we're very hopeful that that research will lead to potential opportunities in the future in the mental health space. We're focused on all conditions, but depression and anxiety are very interesting to us. And so that's another area that we've been researching for a number of years with the UCLA team.
So would like that emotional naming, would that be part of the physician report?
Yeah, so there's actually a physician report too that will give the physician, so if you take your PHQ and your GAD, and it'll actually summarize your naming, and you can take that to a physician. The other neat thing that we do with that state of mind feature is we tie your emotions, we give you kind of a readout, a highlight of how your emotions tie to how much you're exercising, how much time in sunlight, and how much you're sleeping. The reason we do that is those connections we know are very strong. Like 30 minutes of exercise is almost equivalent to an antidepressant. And so we want people to understand
those are science-based that you've done working with people in the psychiatric
Exactly.
community.
And so we wanted to surface that, hey, how you live your life and the lifestyle has an impact on your mental health, and being able to show those connections so that you can make potential changes to how you're living your life to improve your mental health.
So all of this is obviously, through the Apple Health app, which has been going through some revisions. Can you tell us a little bit about where that is, just kind of the original version, what its intent was, and kind of the evolution that it's gone through?
Yeah, the Apple Health app, it's interesting, started really as almost a data container for HealthKit. And HealthKits are basically our standard to be able to kind of transmit information with third-party devices and apps. And so initially it was very much just a data container. And we didn't really give you a lot of insights and give you a lot of guidance.
Just a place to put all the health information you were getting, yeah.
Exactly. And then we started hearing from customers who just wanted more. And so we then introduced the notifications. So now, and then there was a phase where in the health app, you can see the notifications at the top of the screen when you open up your summary tab. Then we introduced trends and highlights, where we started to trend your data over time and highlight changes for you. And then you're starting to see more and more. We're trying to give you more insights over time. So the idea is really, we think the health app is this one-stop place for all of your health data. You actually can get your health records through the health app as well if your provider is tied in with our health records component. And so we are definitely transitioning it over time and have transitioned it over time to give you more insights and guidance.
Okay. And you talked about privacy and how Apple approaches that. Can you tell us a little bit about the back and forth, perhaps, at the company over, the pros and cons of the approach that Apple has taken, which is that for all of this health information that you don't collect that info, which could be valuable in, product development and also improving the product. Tell us a little bit about the decision that the company made and why that's important.
I mean, I think privacy is so core to Apple. It's not just core to the health team, right? It's actually where we begin and end our product development process a lot of times. We really look at, when we're developing product, what features can we develop, what data do we have, and what data do we have to have access to because we need to do a research study for so that we can develop it in a privacy-preserving way. In terms of the decision, so candidly, it was never really a decision. It was just the way we do business. We just don't believe that we should be monetizing data. We don't believe we should be collecting data. And particularly when it's really sensitive data, right? It's your financial data, your health data, it's all on device. It's encrypted end to end with Face ID, Touch ID, and passcode. So I would say that there's not a huge decision. I think where the decisions and the conversation come into place now is when we're developing product, how do we get the right data metrics and what studies do we need to engage in to be able to get the data? That's a piece that we talk a lot about. And then obviously with generative AI, I think the big conversation is like, how do you give insights to somebody in a privacy preserving way? Because if you think about it, when you're using certain providers for LLMs, you're actually sending them your data.
Right.
And
AI is only as good
as the data it has.
Collects, and it has to be real data, right,
exactly.
for it to be effective.
100%. And so it's interesting because it's an interesting trade-off, because I think customers, what's really fascinating is I'm not sure every customer always understands the nuance of privacy. I think a lot of tech companies get lumped in together, and we have a very different approach. So I think if there's any conversation that I sometimes will think of in my own mind, I'm like, we're doing all of this, and do customers understand what's happening in the data? But I am reassured, because I also do get we get letters from customers who say, thank you for doing it this way. And I do think a lot of customers, especially worldwide, are very sensitive to the fact that their data is secure. But I think what that means is we have to think about what processing do we do on device? What device processing do we do in the cloud? How do we maintain privacy on device with certain types of data types? So there's some technical architecture things that will have to evolve over time. But we really do believe, to answer your question, there's not much of a question of should we do this. It's more how do we do it in a privacy preserving way. That's how we approach it. It's not really should we do the privacy.
And has it been in some ways, an impediment or delayed development because, as you said, additional steps have to be taken?
Yeah. I mean, for example, the irregular heart rhythm notification feature, we could have released probably 1 to 2 years before. But because we chose to do the studies the way we did, in a privacy preserving way, we took the hit on timeline. And we do take a hit on timeline very frequently because we do a private, but we're okay with that because we feel like it's the right way to build a product. We build it with accuracy, and I think customers appreciate it. And so like I said, we're not always first to market, and that's okay, but we feel good when we release something, we have released it in the right way. And I think also, to be honest, the regulatory bodies that we work with appreciate our approach. We get a ton of positive feedback on how we run our studies, the quality of our studies, how we do the privacy data protection. And it's something that a lot of the regulatory bodies worldwide, because worldwide a lot of regulatory bodies are very sensitive about privacy, really appreciate. So in general, it has been a positive for us overall.
Okay. And I wanted to ask you about ways that Apple is working with EMR then. How does it work for people who want to load their information to have it in one place so that their doctors can see it? How does that relationship work?
So the way the health records features work is that you actually have the healthcare provider needs to activate Apple Health Records. And so they have to make it available to, there's something called HIE, right? And so they have to enable that the data will be sent to the Apple Health app. And if your provider is a participating provider, we have all of your health records on your iPhone. So for example, in the Bay Area, for example, there's Stanford and PAMF. And if I go to Stanford and PAMF, I can see all of my records in one place. It is largely meant for consumers, that product.
Right.
It is not meant for physicians necessarily. We know physicians have their EMR, so we're not trying to replace that. What we are trying to do is aggregate the records for the user so they have it all in one place. And if they are, for example, in an ER that doesn't have all of the records, they can kind of show that information to the providers.
So when you're thinking about that space, and this is probably why you get asked a lot about why Apple doesn't have an EMR, because this is one of the biggest challenges I think that patients see today in the healthcare system is that it is very segmented and it's very fragmented, and not all of this whole interoperability has been a challenge for decades now, and we still haven't really resolved it. The systems don't talk to each other. They don't seem to be making much headway in finding a way to talk to each other. So as someone who has this information and sees the potential, right, of helping patients, as you said, patient-focused, patient-centered, the key is to be able to have this information available to all parties who can contribute, including physicians, right? Yep. So now that you're making it easy for consumers to have it, the patients to have it. Is there a role for Apple to play in accelerating this move toward interoperability and finding a way to make these health records talk to each other, or finding a universal system where this data can live and really move toward improving outcomes for patients?
It's a really good question. I'll give you this more as like my perspective as a physician, maybe, rather than sitting in the Apple seat first. Candidly, I think that the entities that have the most control over this are the healthcare providers, because they are the ones signing the contracts with the EMRs. And ultimately, they are the customers for the EMR companies, right? What I find is the EMR companies are very open to listening to feedback from healthcare providers. So from my physician hat, I would say it's really those entities that probably have the best opportunity to allow for interoperability and enable that. What I think sometimes happens is I think the industry sometimes is a little concerned about, well, if I give my data and make it interoperable, what does that do to my market share and et cetera? I actually think that, again, from a physician standpoint, I don't think you're going to see that much change, because ultimately patients don't pick your provider based on like, okay, well, you look at the doctor you're going to ultimately.
It's also a very more of a traditional way of looking at the healthcare system, right? Which I think today's patients are probably looking at it very differently.
They do. They look at, where can I get an appointment first?
Right.
That's usually the way I look at it.
And why don't you have all this information if, like, you know, the Gap knows exactly what I bought and what I'm going to buy next, right?
And I will tell you, I can't tell you how many times when I'm doing the H&P when I practiced, I can't tell you how many times patients would say to me,
that's history and physical.
well, don't you, history and physical. They'd be like, don't you have this information in your computer?
Right.
And I'd be like,
why don't you have it?
Why are you asking me these questions? Why don't you have it? So the honest answer on the Apple side is like, I'm not sure we really have a role to play, because like we're not in that, right? Like we are not the patient, we're not a provider, nor are we the EMR company. We can share our customer feedback, and we have, I think, but I think that really comes down to entities where I think who really run.
But as you're saying, if the providers are really responding to their patients, right, and the consumers, and Apple has a really good handle on the consumers and what consumers want, you know, if providers are saying, well, all of my patients want an Apple EMR, you know, or they're asking for one, or they find this more convenient, then they're going to get that one, right? So is there any role the company can play in sort of helping consumers have a voice in this and
I think
push
we can
for a better system?
We can definitely have consumers have a better voice. I think the question is we have to make sure the voices get directed to the right people. I think that's ultimately just like having coming from the healthcare world. I think it's... but I definitely think we're all about augmenting. It's interesting, though. I will tell you, we don't hear from customers so much saying like, why doesn't my doctor have this information? I think customers are feeling pretty good about the information they have from us. So that's it's an interesting point. But I think again, I think it's much more. I think customers really like the data they get from us in terms of what they're hearing from us and from about them personally. We hear a little less on. And I'm just thinking about customer letters we get. I hear a little less on like, hey, my health records didn't have this information in it. But it's an interesting point. I mean, it's an interesting point.
Yeah, because I think now as we're talking about this patient-centered focus, right, and patient-centered world, I think, where people are demanding more information and access to more information about themselves, it does make you wonder about where that will lead and whether we're starting to finally break down some of these silos of a very paternalistic healthcare system where the doctor was the gatekeeper and, you know, the patient never knew what was in their health record or never knew, right, what was, you know, what the symptoms meant and never really had it explained very well. So if we're moving into this new era of like patient-empowered care, it is interesting to kind of think of what role a company like Apple could play, because you do understand the consumer so well. And,
we do,
and you're now, you know, having these forays into so many health applications, and it looks like potentially more.
And in fairness to doctors, and this may get me in trouble for saying this, but it's actually not the doctor, I think, that's always the gatekeeper. I think it's the healthcare system sometimes.
True.
So, and I love all my health system colleagues, but so don't go out and like twist that in any way. But I think sometimes
you're seeing it from a different perspective.
Yeah, I think because I've worked on the health system side and I've worked on the physician side, and like I've worked as a provider, you know what I mean, and I think providers actually just want to do what's right for their patients. And so I want to make sure that they don't get the brunt of that, like just to kind of stand up for my physician colleagues. Like I think a lot of it is sometimes the systems that they work in that are limitations. So
Right.
yeah.
And it is interesting, just to close out, I think it is interesting to think of how a company that's innovating like Apple, right, in terms of changing the health conversation, to really put a lot more of that power in patients' hands, what that can do.
And that's why I want to bring it back to that, because I think ultimately my goal and our goal as a team and our goal at Apple Health is to empower the patient. Because I think if we can give the patient the most information they need, they will have better conversations with the physician. They will hopefully know when they need to go to the doctor and when they don't need to go to the doctor. So to give them more of like, put them in the driver's seat around their own health. But also, I also want to remind everyone that health doesn't just happen in the health systems. Health is about how you live your life every day. And what we really want to do is drive people to be empowered to live their life in a healthy way so that hopefully they don't have to go to the doctor all that often. Like, you know what I mean? Obviously, you need to do your preventative care visits, but like really, like hopefully we can avoid them getting sick. And that's really how we think about our technologies. How do we get people to focus on prevention and proactively pick up things before they need a doctor so they can do something about it sooner?
Okay. Sumbul, thank you very much.
Thank you.
Appreciate your conversation.